Hi, my name is Ronnie Thomas, and I'm a registered nurse and an instructor here at JMU in the School of Nursing. Here we are in one of our simulation labs with state-of-the-art technology where students come in to practice their skills to become a registered nurse. When you obtain a Bachelor's of Science in Nursing, you are eligible to sit for the national board exam called the NCLEX. With that exam, it gives you your license to become a registered nurse. And when you become a nurse, there are many career opportunities that open up to you, and you're not limited to just working in the hospital setting. You can work in primary care and specialty clinics. You could work for insurance companies. If you enjoy research and science, you could become a nurse researcher. If you enjoy working in the community, you can work in community agencies. If you enjoy education, you can become an educator like me. Or if you enjoy government, then you could work on executive boards in government or organizations. There are many career opportunities that are available when you become a nurse. If you enjoy taking care of people's health and well-being, then consider nursing.
So a lot of students come into James Madison University interested in psychology. But what do they do after they complete the psychology degree? So I looked at the last 10 years of data from our graduates, and what really strikes me is that there's such a wide range of things that people report doing. I can identify a few clusters based on the kinds of settings they're working in. So one cluster is because we train people to be behavioral scientists, they might be working on team science, maybe in a university setting, or maybe in a corporation like Facebook that does behavioral research. Or they might be working in a healthcare setting with social workers or nurses to develop sort of healthcare interventions for people. Some of them are definitely working in an educational setting, for example, as school psychologists. And some of them might be working in a business setting, trying to optimize kind of workplace performance. And then, of course, there's the whole range of practice settings where you have one-on-one or group therapy.
Hello, I'm delighted to introduce an exciting major that is Communication Sciences and Disorders. At JMU, we offer a Bachelor of Arts and Bachelor of Science degree in this major. With this major, you can go on to graduate school to work as an audiologist or a speech-language pathologist. A speech-language pathologist is a healthcare professional who identifies, assesses, and treats speech and language problems such as delay in language, stuttering, articulation problems, voice and swallowing disorders, or work with cognitive disorders such as dementia. So SLPs, or speech-language pathologists, work in K-12 school settings, early intervention, healthcare settings, long-term care facilities, private practices. They can also work as researchers and teachers at colleges and universities. Audiologists are healthcare professionals who are specialists in preventing, assessing, and treating hearing and balance disorders such as hearing loss, tinnitus or ringing in the ear, or balance problems. Audiologists work in different healthcare settings such as hospitals, and they own their own private practices, or VA hospitals or Veterans Administration hospitals. They also work in research and teaching, as well as hearing aid and cochlear implant companies. The employability for these two professions are amazing.
The Department of Health Sciences aims to serve students with an interest in health or healthcare fields through a public health perspective. Our degree program emphasizes understanding human behavior, the disease process, the impact of the environment, as well as strategies and methodologies to assist the behavior change and analysis of health concerns. Students completing the general health sciences curriculum may have an interest in working in a community setting in a health-related entry-level position, such as health service community organizations, health policy development, or community health education. The health sciences curriculum can also be paired with the pre-professional health minor, where upon completion, students may be eligible to apply for and attend professional healthcare programs in areas including physical therapy, medicine, physician assistants, and veterinary medicine, along with other professional health programs. Ultimately, the Department of Health Sciences aims to establish future health professionals through education, research, and service opportunities here at JMU.
Athletic trainers are allied health professionals who specialize in working with physically active populations. The athletic training scope of practice can be broken down into 5 domains: risk reduction, wellness and health literacy; critical incident management, which is emergency care and immediate care; assessment and evaluation and diagnosis of injuries and illnesses; therapeutic interventions for managing injuries and illnesses, including rehabilitation, as well as healthcare administration and professional responsibilities. Athletic trainers practice in a variety of settings working with physically active individuals. Traditionally, these fall under working with athletes in kind of your sports setting, traditional settings such as secondary school, college, universities, working with professional athletes, or in a rehabilitation clinic. Newer emerging settings for athletic trainers include working in hospitals and physicians' offices, working with performing arts individuals, including those in the circus, musical theater, ballet, working with individuals in the military, working with public safety individuals, including firefighters, police officers, and FBI agents, as well as working in a variety of industry settings.
Health Service Administration students are training to become the people that care for the people that care for the people. They operate on the business side of healthcare to make sure that organizations are running as efficiently and effectively as possible. They will engage in interprofessional teams, and they also must have a desire to lead organizations from a place of a heart-centered leadership in order to get other healthcare staff to follow their lead. Finally, our students will eventually go on mainly to work in doctors' offices, hospitals, long-term care facilities like nursing homes or assisted living facilities. They might be working with pharmaceutical companies, medical device sales, and recruiting companies.
Physician assistants, also known as PAs, are an integral part of the healthcare team. PAs are able to provide their patients with a full spectrum of care, which includes taking medical histories, performing physical exams, ordering and interpreting laboratory tests, and diagnosing illnesses. They also develop and manage treatment plans for their patients, prescribe medications, assist in surgery, and counsel their patients on preventative health and wellness. PAs are educated at the master's level, so those students applying to the program must have a bachelor's degree and completed prerequisites. Once enrolled, a typical PA program extends over 27 continuous months. PAs can work in most work settings, with the majority of those working in outpatient clinics or the hospital. As well, PAs can practice medicine in all healthcare settings, including primary care, internal medicine, surgery, and many specialties.
Welcome! I'm delighted to be here to talk about the profession of nutrition and dietetics. We work in clinical nutrition, community nutrition, as well as food service and clinical management. Within clinical nutrition, we provide medical nutrition therapy to our patients and our clients in a variety of settings following the nutrition care process. With regard to community nutrition, we see individuals and groups in order to promote health and well-being while preventing and managing chronic disease. And in the management setting, we work in a variety of different types of settings in order to plan healthy menus to support the health of our clients. We work in a number of settings, including hospital organizations, outpatient clinics, as well as long-term care settings. We also work in private practice, as well as retail settings, corporations, and at the university setting level.
I'm here to talk to you about occupational therapy. Most people don't know what we do. When you meet an occupational therapist, we're likely to ask you, what do you need to do? What do you want to do? And what do other people expect you to do? We're going to ask you where you need to be doing those things and when you're going to be needing to do those things. Our scope of practice focuses on occupations, the environments that people are performing them within, and the person themselves. We look at completing evaluations, designing client-centered or personally tailored interventions to help people achieve the things that they want and need to do in their daily lives. Where can you find us? As you can see, there's a variety of practice settings where occupational therapists work, including people's homes, out on the road, in hospitals, in communities, both in terms of physical and mental health facilities as well. Occupational therapy is a vibrant and rewarding career. We hope you look into it more.
Hi, I'm here in our Human Performance Lab to tell you about our undergraduate programs in kinesiology. We have 2 programs with really different interests. Our Physical and Health Education Teacher Education program prepares students to teach at the K-12 level in both health education and physical education. It's a 5-year program that results in a master's degree. Students in this program learned how to build curriculum that serves students with diverse abilities and helps foster that love of movement and learning. Our other undergraduate program is in exercise science. In this program, we examine exercise from all different sorts of angles, including biomechanics, or the physics of movement, the physiology, or what's happening in the muscles and cardiovascular system as we exercise and as a result of long-term exercise, and the psychology of exercise. What can we do to help people learn how to be more active on their own? Every student in this program completes 2 capstone experiences, which my colleague Jana is going to tell you more about.
The exercise science students complete 2 required practical experiences. The first is completed during junior year, and the second is completed during senior year. Students can choose where they complete their practical experiences, and they earn credit for each one. Some examples of where students complete their required practical experiences are within the kinesiology department in the Morrison Bruce Center or in the Empowerment 3 Center. Outside of the kinesiology department, students complete their experiences in JMU Strength and Conditioning, JMU Athletic Training, or the University Recreation Facility. Off-campus is also possible in the Harrisonburg community, as well as the student's hometown, or internship as a study abroad in Australia. When our students graduate from JMU, they are employed as rehabilitation aides in fitness wellness facilities, personal trainers, sports performance coaches, sport coaches, medical assistants, to name a few. A small number of our students commission to the military. Other students choose to go on to graduate programs like the Doctorate of Physical Therapy, Doctorate of Occupational Therapy, Master of Science in Exercise Physiology, or Master of Science in Athletic Training.
So what do social workers do? We help empower people to find the resources and support they need to be contributing members in their families, in schools, in their neighborhood, in the community, and maybe where they work. We work with people from all walks of life and at all ages. We help children and families in the foster care system, families who need food, clothing, financial and housing assistance, people who have substance use issues, those who are in jail or probation or parole. We assist people with places to live and help them find jobs. We work in retirement and nursing homes, hospitals, mental health institutions. We support military veterans, students in school who may need extra help to do well, immigrants and refugees to integrate into the community, people with intellectual and physical disabilities so they can live independently in the community. We're mental health therapists and counselors, and we even work in the NFL and NBA. Wherever and whenever people need help, social workers are there. So, if you're a good listener, are passionate about helping people, enjoy learning about different cultures, see wrongs in the world you might want to make right, you may be a good fit for social work.